From day one on this very program, we have exposed the devastating impacts that Obamacare would have on you and your family if it was passed and if it was implemented. And so tonight we begin a week-long series called You Were Warned. And over the next several days, we're going to remind you of some of the cautionary tales that were told on this program before this train wreck was implemented. For example, earlier today, the president sealed the deal on health care, signing the bill into law and forever changing the United States of America. Now, to break this down, it means higher taxes and lower quality of medical care for you and your family.
America has some of the top health care and top medical technology available anywhere in the world today. What makes it so great?
The current health care system is based on choice. We need a system where Americans can choose the health care they want, just as they can choose to buy one automobile versus another.
Now Congress has decided it wants to throw another choice into the mix, a cheaper government-run, quote, public option for insurance coverage. But don't worry.
If you like the plan you have, you can keep it. If you like the doctor you have, you can keep your doctor too.
When President Obama says that you get to keep the health care you already have, he's being completely disingenuous. Millions of people are going to lose their current health insurance in favor of this government insurance.
Hate to say we told you so. Joining me now with reaction is the man whose alarming prediction has now become a reality. From the Fox News Medical Aid team, Dr. Mark Siegel, Fox News contributors Jamu Green, and Tony Saig is with us. Good to see you all. Look, I said it, you said it, there were a few of us that got it. As we've been putting up on the screen all night, you don't get to keep your same plan, you're not paying less money. All these promises are not true.
Sean, if you and me look better than we did 4 years ago, it's no thanks to Obamacare, I'll tell you that.
Yeah, by the way, do I look, I think
yes,
I think I've aged.
You look great. You look better, and it's not no thanks.
Well, you made me lose weight. You told me I was too fat.
You look great.
As a doctor, you said I was too fat.
You worked out and you use exercise. That's the way to go. Because right now, health care is in trouble. And what Obamacare really got wrong in a big way is understanding that we're talking about the health care needs of the people of the U.S., not the health insurance needs. It's a totally different thing. Before they started this, we were all in trouble with insurance to begin with. There's too much health insurance. It covers too much. Too many people have it, and they can't get in my office to see me. I'm full. I'm busy struggling with electronic health records. I can't see all these people. There's a shortage of doctors. So what do? They're going to pay us less.
Let me get Jamu in here. Jamu, I just mentioned the stories, people paying $10,000 more a year, $1,800, millions of them. We have millions of Americans kicked off their plans, the very heart of the promises the president made. Now, I want to ask you, doesn't the president have some explaining to do to the American people that his core promises are broken?
I think he is explaining, but let me do some explaining for you, Sean. The people getting kicked off of these insurance plans, they didn't have real health insurance to begin with.
Yes, they did.
They had faux insurance. It was all hat and no
You're justifying.
cattle.
Wait, stop,
Sean,
stop. Wait a minute. The president said, if you like your plan, you keep it. People like it, and they're being kicked off.
They don't know if they like it because they haven't used it. They haven't used it, and when they try to use it, it would be like going to a gym.
There is a reason this liberal ruse has taken shape, because they have to justify the fact that one of the essential promises made by this president in selling Obamacare is completely false. To your prediction, Doc, is a lie. The fact that if you like your doctor, you could keep it. Why are they kicking off these people based on these Obamacare regulations from these predatory, quote-unquote, insurance plans? Because these are cheap plans that mostly young people buy, and they need young people, young healthy people, and they need young people to go into the Obamacare.
Young people like catastrophic insurance.
Absolutely, because it's cheaper. And you know, the whole idea behind Obamacare is to rope in young people to pay for older people who are sick. And by the way, the biggest lie here, or disingenuous statement, is the idea that you can keep your doctor. You can't keep your doctor because Obamacare insurance has these narrow networks that your doctor and your hospital are not participating in. I have one more thing. If the government wanted to address the people in this country who needed health care, they could have done it directly, like build a bridge or fight a war.
10 seconds, go.
Can you imagine buying a gym membership, showing up to the gym, and they tell you you can't use the machines, you can't use the weights, you can't use
If that's the membership you bought, that's what you get.
That's the membership you bought, yes.
That's the type of health insurance they were selling.
That's a good point.
It wasn't real.
Coming up next, thank you all. Dr. Charles Krauthammer is here to weigh in on a new report that a college classmate of Michelle Obama is one of the executives, top executives at the company that built the healthcare.gov website. And by the way, that was a no-bid contract. Coincidence? Or is there a scandal brewing here? And then later, last week, we introduced you to Earlene Davis, the friendly Obamacare operator who answered my call on the radio show. She was fired for speaking to me. Tonight, we have some really good news that we will share with you shortly. Straight ahead.